Hafide and good morning, Madam Speaker and members of the 35 na Legislatura in Guam. On March 15, the island woke up to the news of our first COVID positive cases. That same day, Italy reported a total of 24,747 confirmed cases, and their death toll rose 25% to 1,809. Deaths in Spain more than doubled in a day to 288, with the number of the infections near 8,000. New York had over 700 cases with 3 deaths. There were a total of 1,224 confirmed cases in California. Closer to home and our tourism source markets, South Korea reported 8,162 confirmed cases with a total of 75 deaths. COVID-19 infections in Japan increased by 30 to 803. That was the world on March 15, just 2 months ago, when we confirmed our first cases. And that could have been Guam's reality. By all accounts, we had a small window of opportunity to prevent that from happening. Knowing that our first cases were recent travels to the Philippines and that President Duterte issued an order on March 17 that effectively gave visitors to the Philippines just 3 days to vacate the country, we had to act quickly. Invoking her authority under the Public Health Emergency Act, Title 10, Chapter 19, Governor Leon Guerrero used her emergency purchasing power to obtain quarantine and isolation facilities. This was necessary to contain the virus and prevent the collapse of our healthcare system. Contrary to popular belief, this was necessary because the governor of Guam did not and does not have the legal authority to close down an FAA facility like the Guam International Airport Authority. As COVID-19 has so clearly demonstrated, the danger comes from more people needing acute treatment than healthcare systems can handle. Every step we have taken, every course of action has been done with that in mind. We began fit testing our first responders early on, and we made sure they never ran out of personal protective equipment and that all of our patients would have access to ventilators. We worked and continue to work with the CDC, HHS, and World Health Organization to maintain a steady supply of test kits. The data has shown that all of our efforts have helped contain the spread. The ultimate goal is to protect our hospitals and reduce the number of cases that require acute care. We must not forget that at the beginning of April, Guam had 20 COVID patients in the hospital, and that was already placing a strain on our healthcare system. In closing, Madam Speaker, I want to thank you for this opportunity to brief your committee and our island community. I think you know that my faith is important to me, just as I know it is to you and the rest of us. The governor's prime directive was to save lives and lead us to a place where Guam could begin the long, slow road to recovery. That is where we are now. Along the way, we also demonstrated the legendary hospitality of the Chamorro people. Because the governor was willing to make a tough call in uncertain times, thousands of U.S. sailors are fit for duty among the USS Theodore Roosevelt. While that decision seems easy now, ensuring the safeguards would work required effort and unprecedented cooperation. The risks were real, but so too was the governor's moral responsibility to do the right thing, regardless of the criticism. Thank you for the opportunity to present on behalf of the Leon Guerrero Tenorio administration. And with that, I yield back any time available to us.